PAD, or peripheral arterial disease, means that the blood vessels, the arteries that deliver blood that carries oxygen to the extremities, are compromised, and the arteries aren't delivering sufficient oxygen to the tissues to maintain their nutrition and their viability. I'm Dr. Allan Caudill. I'm Medical Director of the Bronson South Haven Wound and Hyperbaric Treatment Center. So in the wound clinic, it's one of the most common problems we see in patients, because what happens as this oxygen, and oxygen is a medicine that's in a way that's utilized by all tissues to regenerate and heal, and it works in the immune system. It's exceedingly vital in what they do. So what we find is many of these patients don't have adequate oxygen to heal wounds. Normal people, they injure themselves, cuts, bruises, scrapes, trauma, and the body in a very elegant process heals these wounds in a short amount of time. The patients that end up in our center have not gone through that normal process of healing. And the two main problems we see that cause that are diabetics, because they have a loss of sensation or neuropathy, and people with vascular disease or PAD, because once they are injured, the body doesn't have sufficient oxygen to proceed through the healing process. And we see many patients with diabetes and PAD because diabetes has an impact on the blood vessels in the extremities that can compound the effect of peripheral arterial disease.
My name is Dr. Brian Akrami. I work at Bronson South Haven. I'm a cardiovascular physician. So once we've established that the patient has PAD, we've done the right things to modify their risk factors, we also get a sense of what category they may belong to in terms of definitions of types of PAD. There's a couple of different categories. Asymptomatic, or people who do have PAD and it doesn't bother them, or they're not aware of it interfering with any of their activities. There's claudication, which means people who have leg discomfort when they walk, typically, and when they stop, it's relieved. So that's very typical PAD symptoms, and there may be other atypical symptoms, but typically it's brought on by activities such as walking, and when they cease activity or rest, that improves. The third category is considered critical limb ischemia, and that's really dangerous. These people may have severe discomfort and pain without even walking. That same discomfort is occurring at rest. And at that point in time, for those with critical limb ischemia, it's gone beyond just the medical therapies and the prevention or rehab for the legs. They need some intervention or revascularization as well as wound care. Good communication is key in care of the patient, and that holds especially true for those with peripheral vascular disease and wounds and critical limb ischemia. It's not uncommon that there will be a two-way referral process. I may identify a patient with severe peripheral arterial disease and diagnose an ulcer during my course of care for them, and I'll refer them to the wound care. Or similarly, they may identify a patient with peripheral vascular disease and a lot of these cardiovascular risk factors, manage the wound, but also make that referral to me so that I can help to modify their risk factor and their risk factors and educate them about the process of cardiovascular disease as a whole and how it can impact them, as well as employing the assistance of our vascular surgeons, our colleagues, who may help us to revascularize.
Well, PAD is a very common disease, especially in the elderly population. 1/3 of patients age greater than 65 have peripheral disease. When patients come to us, normally they have symptoms of leg pain or non-healing ulcer. So normally we'll start with doing an arterial ultrasound to see how bad their disease is. My name is Wade Kang. I'm a vascular surgeon who works in Bronson, mostly in Methodist Hospital and Battle Creek Hospital. From there, it depends on patient's symptom. We divide them into claudication patient and then also critical limb ischemia patient. And the treatment approach is different. For most patients will have claudication symptom, which it does not have critical limb ischemia yet. We treat them with medical management, and we have walking programs, and also most importantly is medication. So with appropriate medication, we can decrease patients' mortality on those parts. And also, if patients have advanced to critical limb ischemia, then we will, of course, start to treat patients. The treatment is twofold. One is we treat them medically, including antiplatelet therapy, including statin therapy, which from medication part has been proven those medications can prolong a patient's life. And the other part is from a surgical standpoint, we improve their blood flow to their limb, and that can be done surgically or endovascularly. And now we can do, I think probably 70-80% with endovascular treatment, which is only a day surgery. Most people come in during the daytime and then they go home the same day, and the recovery time only takes less than a week. And then once the surgery is done, I routinely follow the patient, maybe 6 months, maybe yearly, depends on their symptom. Majority of my patients have a significant improvement after treatment.
I tell people vascular supply is like plumbing. It's just much more complex, but it's a pump delivering fluid somewhere. And as you know, either if you've got a clogged pipe or a bad pump, your pressure goes down. You get in the shower, you turn the valve, and it's the same thing on a more complex level. So we have to optimize the pump, which cardiology does. And then we have to optimize the patient. We work with their primary provider to make sure congestive failure, diabetic control, nutrition is very important. There are a lot of nifty new procedures they can do, like they work on the heart with stents and balloons and small incisions, endovascular interventions that can allow them to really go in the smaller vessels that never used to be able to be worked on, and do very good manipulation through small incisions and get more blood flow back to the extremity. And they're very good at what they do, and once they do that, it allows us to then utilize all the science and things that we can utilize to get that wound to heal. The main thing is getting people in the system in a way that they can, stop the process before they have to come and see us, control their diabetes, smoking, all those things that will just help them stay healthy and enjoy life for a long time.